Thank you, Mehailah, for the glimpse into the future and how the public sector has actually changed the CX landscape. Next, we'd like to invite Mr. Juma Alajme, the Director of Digital Health in the Department of Ministry of Health and Prevention in the UAE. Mr. Alajme is an alumni of the Mohammed bin Rashid Leadership Development Program in Executive Leadership. He's leading national initiatives like the National Unified Medical Records, where it impacts all different stakeholders of the community. He's also associated with the Duke University and of the Government Experience Exchange Trainers from the UAE Prime Minister's Office program. Mr. Ali, may we request your astute insights, please, and please welcome Mr. Ali Alajme.
Assalamu alaikum wa rahmatullahi wa barakatuh. Ladies and gentlemen, distinguished guests, first of all, I'm very happy to be here, and I would like also to thank you, Khalij Times, for arranging this events, just to exchange the knowledge and the experience that we had in Ministry of Health and Preventions with everyone, and we learn also from the other entities what we have done, what they have done, or what we can have done. As you may know, I will keep it very short, and as we have multiple initiatives within the government are related, and we coordinate with everyone together. Under the provinces of His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President of Prime Minister Office, and the owners of Dubai government, Ministry of Health and Prevention has worked with a lot of initiatives just to increase the happiness and the leverage to meet the expectation of their customers from different angles, whether they were like citizens, patients, communities, physicians, doctors, business owners, and collaboration also with other entities. And you have touched it also during the COVID-19. We came up with a lot of initiatives. We did a lot of collaboration just to make sure that everyone is safe and everyone is facing and having a good experience while they're maintaining their healthcare sector. Ministry of Health and Prevention has worked with multiple initiatives to break the silos between the public and private sector, and came up with initiatives to exchange the data to maintain and make sure that the citizens get the right services, the right healthcare provisions that is coming from the different angles. We came up with the National Unified Medical Record Riayati, which is now linked to more than 450 facilities, and we're also going to increase, linking 9 medical records that the physician can access the medical record and provide the right healthcare services to the patients. We also launched the UX Lab, which is maintaining how the customer experience that's happening within the Ministry of Health and Prevention from all of their different backgrounds, and it's been launched by leveraging the technology of AI, the technology of the digitalization, and we also categorized all of these services structured under the Ministry of Health and Prevention website by leveraging a high-end or state-of-the-art content management system. And also there is a whole team working with it, making sure that they are providing the right information and the right data to their customers. Plus, and you have seen it in COVID-19, we're providing the messages to different languages. We're in a country that's having more than 200 nationalities, and we wanted to make sure to increase the leverage the information or the technologies to give them the right information by leveraging all type of languages under 5 languages, whether it was in English, Arabic, Chinese, and Urdu, and also Farsi, just to make sure that our information is reaching every citizen within the country. This is just the start. I think in the COVID, we break the silos and we leverage the interoperabilities and the technology to integrate everyone, to connect everyone within the right technology. But now we're in a different era where we are going to create a customer-centric view for every citizen within the country, just to empower them to take care of their healthcare by leveraging the technology and the data they have. And thank you for listening to me.
Thank you, Mr. Ali, for sharing your thoughts and kickstarting the day's proceedings. Now we're going to start our power-packed panel discussion, how the UAE public sector is reshaping the CX future. Our panelists are Juma Alajme, the Digital Health Department Director of the Ministry of Health and Prevention. We have Mehailah Hashel Zehmi, Director of Customer Happiness Department of the Roads and Transport Authority, the RTA. Mr. Shabdar, MEA, Regional Director of Zoho Corporation, and our moderator, Marc Karschies, the Managing Partner at KCA Consultants. To introduce Shabdar is the Regional Director of the Middle East and Africa at Zoho Corp, a business technologist, advisor, and published author. Ali advocates for practical and profitable digital transformation with added focus on customer and employee experience, information management, and privacy. Passionate about people, process, education, and business strategy, Ali presents ideas about the best uses of technology in the service of business and society with a triple bottom approach. The moderator, Marc Karschies, is the managing partner at KCA Consultants, an international CX and service strategy consultancy firm based in Dubai. Marc is considered one of the leading experts on customer experience strategy and service quality management in the MENA region. Marc, we request you to start the proceedings as the moderator, please.
I'm not sure if the mic is working. Can everyone hear? Test, test. Wonderful. Your mic's working over there? Is everyone clear?
Hello.
Oh, perfect. It works. Brilliant. Salam alaikum. Good morning, everyone. Thank you very much for showing up for such an esteemed event, for learning about customer experience, being exposed to more ideas from other industries, from other partners, for networking, and for being here. Thank you very much for Khaleej Times for putting this together. And of course, thank you very much for this esteemed panel to be here and help us out in answering some questions and bringing us together. So we had the introductions over here, and we saw already in the speeches from Ali and from Mehailah that there's a lot of work being done inside the governments and in the public sector on moving customer experience forward and making this place, Dubai, our home, a better place, not only now, but into the future. And we heard about some of those very, very well-defined projects and initiatives that arguably we experience on a daily basis. But now, of course, my question would be, what will the future bring? How is this customer experience leading into the future? How is the public sector continuing to reshape the customer experience in the future? That is a topic that we want to discuss, and at that point we have this panel over here. So let me ask Mehailah, maybe, ladies first, and the first question out here. You mentioned, obviously, the influence from Sheikh Mohammed bin Rashid Al Maktoum, that he is obviously very, very strong in customer experience. But the leadership is going into the different areas of the government sector, into the leadership inside the entities. How do you actually see the importance of leadership on customer experience, and how is this shaping the customer experience inside your organization and in the government itself?
So, can you hear me?
Yeah.
So, very good question asking. The involvement of leadership in the CX and customer experience of the services become an essential for all organizations. So the idea of a solo work on services design and just launch it to the market without the involvement of internal employees and leaders, and without getting the visions of the leaders as well to deliver while you are designing that service is not an option anymore. On all days, there was a technical team with a business team deciding that this service needs to be enhanced, and they go and for a month, and they come back with the service and they launch it to the customers. So that is no longer an option anymore. Our leader always give us the direction on what they want to vision for the organization. And our job is to design and customize and evolve our services to deliver that service and deliver that vision. And the customer need to see that vision while he's trying and interacting the services with us. Other than that, I am delivering a service that has nothing to do with the vision of that organization. From an RTA leadership perspective, I'm proud to say that His Excellency involvement with us in customer happiness and customer experience is important. He's always with us while we take the decisions. He will always direct us on the way that he wants the service to be. And from that visions and directions, basically we drive the execution of the services. I hope I answered.
Yeah, absolutely. Thank you very much. And you touch on a lot of points here that the leadership and the support of the people is absolutely vital, and in communicating what the vision is. And to seeing that this vision is so well structured through into the subunits as well, like your unit, the customer happiness department, as well as the other areas in there. So that's very well done. Ali, let me bounce over to you there. When you hear that the leadership comes through and therefore the people need to be engaged, obviously with RTA, you don't want to engage with, let's say, parking attendants because they just maybe wrote you a ticket. But let's say in the healthcare sector, obviously we want to engage with doctors, with nurses, and the people aspect comes in. How do you see the vision and the engagement of leadership with the people being enforced at Mohab and in the healthcare sector?
Thank you, Marc, for the question. Usually we have a say that it's the engagement of the customer happiness, it's a responsibility of everyone. So especially in healthcare, if you go into the patient happiness, the patient expectation is increasing and they want to get their healthcare services, you see it only from the patient side, but behind this there is a whole ecosystem that's working. There is the nurse, there is the physician, there is the one who's working within the lab, and there is also the regulatory and the public sector. They're overseeing the data that's been having. And when we had the COVID, I think it's a learning curve for us. We changed a lot of things, and we changed a lot of policies and procedures and rules and regulations within the country just to make sure that we make sure that the patient experience within, or the physician and the nurse experience happening within the hospital is much easier. So we came up with multiple initiatives just to break the silos between the public and private sector, and to engage more about the one who's within the field, such as the physician. One of them is the Ra'ayati initiatives, where it's a health information exchange, where you exchange all the data in a secure manner, where you have the privacy of the patients, and at the same time, it's allowed for the physicians and the nurses to access the data to provide the best healthcare services. And I hope there is no physician here within the audiences. The physicians usually they want to provide the best healthcare, and they want to have the information in maximum 1 minute is like too much for them, because they are taking the life. So when we implemented the technologies for them, we wanted to make sure that they have the right data, they have the right information for the patients, so that we reduce the medical errors or the access to the data for the healthcare. I believe in COVID, we had this, and we provided the services to the patients just to make sure that everyone is safe, and also the information that's coming to the audiences within the, it's been gathered, all of it from all different sectors. Because, as I said, it's a responsibility of everyone, and all of the sectors are engaged, and the safety of everyone are a responsibility of everyone, whether it was patient or also for the physicians who are working with the service.
Brilliant, thank you very much. And I think it's very important points that you address over here, that customer experience and customer service is, of course, very important on the people side and in the interaction that is taking place. But in order to provide that service, you need to have the right infrastructure, the technology, the data to work with in order to enable those services. So Ali, let me come over to you then. Of course, you're in the business of providing data inside client organizations and being able to provide the infrastructure and the technology aspect. Do you see similar trends coming up in or going on in the customer experience space? Or do you have like a slightly different twist on this?
Absolutely. It is exactly the same, both in private and public sector, and we see this every single day with our clients. The push towards focusing more on customer experience and employee experience in turn is becoming more and more evident. Because in the private sector, which is a competition-based market, the customer experience itself becomes a product, becomes a differentiating factor. So, and one of the reasons probably we exist as SaaS companies, cloud-based companies, and our extended focus on providing end-to-end customer experience solutions is that the customer wants it. It's not that we come up with the solution and then we sell it to the customer. We can see that the leadership across the board in both sectors, they are focusing more on how they can create a better journey, a better experience, if you will, for their customers and also for their employees. We keep focusing on productivity and efficiency for the past 50 years, but what we've been doing to our employees, in the past at least, is that we give them clunky systems. With the new age of technology and focusing on what matters in the front lines, although the leadership, as was mentioned, is a top-down approach, but there's a lot of data being collected from the front line and brings the focus back to how we can add a little bit more value, going more and more into providing a better experience for the customer. So yeah, the short answer is that yes, absolutely, in both sectors.
Yeah, and we see that probably, Mehailah, when I look at RTA, there's obviously a significant improvement on the IT channels and on the self-service channels, the app support, the website integration that is taking place. But yet you still have very strong focus on the contact center and the service center availability, so an omni-channel and multi-channel approach. However, I think that the number of calls or the number of interactions probably has gone down by utilizing this technology. Maybe you can tell us a little bit about that.
You're absolutely right, Marc. One of the things that we invest on as an RTA is moving our customers to alternative channel for availability of 24/7 with no dependencies on frontline staff or agents or human interaction. So one of the key roles that we transfer call center of RTA to do was to educate those possible audience for our alternative channel and take them along the way on the training and the knowledge transfer for them to move in a comfortable zone to alternative channels. It is hard to launch a channel and just ask people to move to it. The education part is required from an employee perspective and customer perspective. What we done with, we utilized our face-to-face interaction in our centers, and we utilized the call center because it has a high demand of a footfall on both channels. And we work that out to be able to help us to move people to alternative channel with no complaints. So for instance, we have in our Customer Happiness Center a digital adoption ambassador, where basically he welcomes our customers and asks them about the service that they want to perform on the counter and tell them, hey, we have the same exact service with exact SLAs, with the exact result in our channel. Come and let me teach you how to do it. And we walk him step by step. It took us almost 9 months to see the result of that kind of education. The same thing happened with call center. So what we done is we knew the repeated customers, they call for what kind of a service. We know their backlog of the transaction. So what we started is we formalize a team called a customer-centric training teams, where basically they called those customers and educate them about the availability of that services on the channel. Definitely the incentive was also a part of the experience, because to move people, you need to incentivize them with something. And when you design your digital services, you definitely need to give an edge for that digital service to compare to the offline service or front-end service for the customer to be appealing more for customers. Be it a discount kind of an incentive, be it a faster kind of a response if you go to alternative channel. But from my perspective and the way that I operated in my department, customer happiness department, is all the channel build up on each other, and each channel should support the other channel to move forward. So there is no more of a silo. I am an owner of a call center or an app or a website, and this. It is the same customer interact with me across different channels. So it's better for me to give him the experience that equal across all channels. And he doesn't feel special in one and not special in all. It's hard to deliver, to be honest, because I would say making people happy is very difficult. But we are investing our employee to do that role. In the beginning of my speech, I mentioned the knowledge and the employee play a big part on the customer experience. They cannot go as an individual, I would say, or not involved in it, because they will be the one who drive your customer experience eventually.
Yeah, and you mentioned here like the keyword of integration, because if it's not properly integrated, one side of the business will not know, or the organization will not know what is happening on the other one. The second part, I had to chuckle a little bit when you said it took us almost 9 months. If we think back 5 years or 10 years, a 9-month implementation time frame would be outrageously fast and incredible in there. So
I don't find it fast.
times have shifted and the expectations are higher. So Ali, you probably see that a lot with implementations, that the expectation now in going for the technology aspects has significantly.
I think you deserve a medal because we deal with this on a daily basis, and one of the biggest, if not the biggest challenge for any large organization, especially if they are focused on CX and EX, is to get their departments to talk to each other. This happens way before even talking about technology, where you start a meeting, where you throw the idea in a meeting room and say, what if we did this? And people quickly go back to their departments because we are resistant to change, we have the fear of losing control, et cetera, everybody knows about it. And to manage doing this in 9 months, it's an amazing work. I've worked in multiple countries in this area, and I have not seen anything happening like this. And just to add one quick point, as a consumer, I see the effect of it. One simple example is registering your car. This year, 5 years ago, 10 years ago, 15 years ago, 20 years ago, if anybody lived long enough here, you know what it was and what it is today. It's amazing. And if you lived in another country, I leave the comparison to you.
Brilliant. And I mean, I think everyone in the room can vouch that, same with driver's license.
To your point, leadership vision helped a lot as well. So the direction was same for all departments within RTA, and the vision was clear for all of us that this is need to be achieved. If everyone is on the same page, it's much easier for us to do the implementation and bring everyone on board. But if everyone have his own opinion and his own choice, it becomes difficult. Empowerment is another thing that leadership provides us as, I would say, centralized departments to manage all the services and give this whole experience. Without leadership vision and empowerment, I would say it will be impossible in organization as big as RTA.
Absolutely. And I think, since the panel is talking about how the UAE public sector is reshaping the CX future, we see already certain topics coming up. Very strong leadership, long-term thinking, empowerment, really integrating the different areas that come together, omni-channel integration, that it's not only in isolation, but everyone working together. And the technology support, the fast turnaround times, but at the core, the people as well. So Ali, that all sounds good in the planning and the long-term effect, and then comes COVID. So from one day to the other, or from 1 month to the other, you have like an extreme transition that takes place. And I think you and the healthcare sector were significantly impacted, probably more, even though we all got infected, but not infected, impacted, probably more than anyone else. How did you actually achieve that? How did you actually run those changes?
Well, first of all, I think it's you need to be prepared. And I will just mention one thing. We know that in the future that cloud computing or use of AI or use of, we call it the IoT or the gadgets right now, everyone is having it as the Fitbit or it's coming and it's going to impact the healthcare. So, and the interoperabilities, the connection between all of these information that's going to come in the future. So in 2019, we said that we need to allow this under a governed rules and regulations that are happening. We published the health ICT law, allowing the private and sector even to bring their own technologies and give it to the consumers under a certain governed, I would say, circumstances under these laws. And we came also for the medical liability law, where we allow even the telehealth, the video conferencing and these stuff, it's happening. And this is in 2019, and we have no idea that COVID is going to come in the future. So when the COVID came, I said, now we are allowed by the law. And I think let's put it in a test. So and have you seen it? Some of the clinics that have provided the telehealth, the video conferencing and the consultation that happened during the COVID, and the connection while breaking the silos between the private and the public sector to exchange the information, and thanks to the health ICT law, I believe the success of this was you need to be prepared, you need to be agile. I remember I had a call during the beginning of the year before the vacation, and they said tomorrow we're having one January 2021, and we need to build multiple facilities, field hospitals, within maximum 1 week or 2 weeks. And usually we had the hospital to be built within months, because you need to train the healthcare facilities, the healthcare providers. Some of them, they came from different countries. They are new in the market. So our beloved country with the leadership, they were very agile to change the process and the whole ecosystem. So we came up with, before we used to implement systems that takes months, and with the changes, we build them in weeks, because it's more focused, more customer-centric for the COVID infected patients. And immediately all the field hospitals were built, and the physicians and the nurses, they were educated within a short time, and they were providing directly to the patients full-fledged system, full integrated system with, I believe, everyone, they have Al-Hassan right now. It's also linked with Al-Hassan. So all of these agile integrations, leadership, policies, implementations, and rules and regulations were impacted. It's how you strategy execute a full-fledged system that will make sure everyone is safe within the country, because it's a responsibility of everyone.
Brilliant. And we see now the themes repeating over. the very quick execution of a strong vision behind it, the customer centricity, understanding what is really behind it, what is good for the citizens of this country, the people integration, the cross-functionality inside the organizations, and so on. Ali, probably the last question to you before we have maybe time for one or two very quick questions here. When you actually see in the UAE the governmental sector probably being leading, I would argue they're probably leading in customer experience and the implementation, and they're putting so much pressure on the private sector. How are you then, as a company that obviously works globally, that has like a lot of different areas that you not only work with, but also work in. How do you actually learn from those experiences? How do you spread that word out? How do you actually see the UAE sector or the UAE government sector leading the pack, or do you see other good examples that would be there?
I'll start with an actual example. We've partnered up more than a year ago with Dubai Economy, which is now Dubai Economy and Tourism, to provide to the SMEs who are registered under Dubai Economy with special facilities of digital transformation. For us, it was helping the SMEs digitally transform their business, and of course, for us, is also good business. But a good part of it was the mission of DET itself, to provide better customer service and experience for their own customers. So it's so interesting. The authority itself is digitally transforming itself, focusing on customer experience, and wants to bring its members, who happen to be SMEs in the city, along with themselves. Added value service, while providing a platform to educate them practically and provide them with the tools as well. So that was one example which we really appreciated, and it was successful. It is actually ongoing. And we took this story to other cities, to other countries, and we were delighted to see actually somebody is picking up the phone and calling us from Saudi Arabia and talking about, what about that thing in Dubai? So we opened those conversations. So without even going and talking about it, the behavior and the examples become an inspiring story to begin with. Now in Africa, we're doing similar work, and we are helping those government authorities championing their mission, and of course, we're happy about the results as well. So we have this on a daily basis. And in addition, is that when the space of conversation is about these things, when you see a government compared to other governments focusing on leading edge technology, a lot of it might be conversation. We might be skeptic that is marketing. So be it. You create that space first, then reap the benefits 5 to 10 years later. Again, I want to go back to how it was and where it is today.
Yeah.
Thank you.
Absolutely. And I think that is a testament that in a city like Dubai, at a conference like this, we can get 150, 160, 170, 200 people into the room, all interested in CX. If you go into any other country in the world, people would need to come from everywhere, from other countries, to fly in for hours to go to a conference like this. Here's like most of us, or many of us, are from the same city, showcasing and being at the epicenter of that development. And of course, the public sector being on the forefront with the strong vision that we have in there. So that is kind of like from the panel side. Thank you very much for that. Maybe you have time for one question. Anyone out there? Yes, there's a question over there. Do we have a microphone there?
Hello, thank you. Yara Wahbi, Head of Business Excellence, Masafi. The question is for Mehailah, actually. When you first assumed your role, what was the first thing you did?
That's a quite hard decision, and 6 years old decision. I would say the role that I have been given to, my first task was to make people happy, which was a challenging, because you need to be happy to make them happy. And you need to convince yourself, and you need to build something that you are proud of, that people can see eventually and start using it. So the first thing actually I used is the historical data that we have as an RTA for the past 3 years. And that was in 2017, I would say. Historical data helped us a lot to understand the pattern and the trend of our customers and why they go away from our services and move to other Emirates and why they don't use this channel and use that channel and why this service in specific have a high transaction compared to a similar service that have the same experience but lower transaction, although there is an appetite in the market. After collecting all that data and historical data, what we done is I run an extensive sessions with customers to understand what is the problem exactly. Because I didn't want to see the business side of the equation. I wanted to see the consumer outside in equation. You hear things that you cannot I would say, cannot mirror in a scenario, in an infrastructure or in a service. Because some customer has a specific kind of formula or inputs or situation does not allow them to move forward on the service, which we as a business didn't think that people have it. What we done is, with all this insight, we went back for 2 months, said, okay, there are these kind of specific scenarios that we need to build a service for, or we need to enhance the service for. And from there we start. We didn't stop at that stage only. We continually engage with them to see if what we are delivering or what we are developing does make sense to them or not. You'd be surprised, one of the last sessions that I have with one company who transfer eggs from Abu Dhabi to Fujairah. So he came to my session and he said, I'm happy, I don't have any problem, but I have one small problem. He said, I told him what? He said, when I pass by Dubai, I need to pay a different permit than the one that is applicable to all Emirates. So I told him, okay. He said, and I do transfer like daily basis. I need to pass by your road for me to go to Fujairah. So I told him, okay, come. I brought the business owner. I told him, what is the scenario here? He said, yes, the scenario is very minimal, but he is, as a company, is being impacted with like 20 trips a day. What we done is we went to our legal team and registration team. Then we done the integration to allow that permit to go with no additional cost for companies to transfer through Dubai, because we were missing them from registering in Dubai. That was a minimum category of customers where they were not able to register their car in Dubai, because if they register it in Dubai, they will not be allowed to transport anywhere, and vice versa. So that segment was missed from our scenarios. We fixed it because of that workshop. And now we have new customer personas coming to our database. Data is very crucial for us, and the knowledge and hearing the customer is also very key point for us to enhance. Other than that, it will be always a business perspective away from, because we think it's correct. We think everything that we do is correct, but actually it's not correct from a customer. Brilliant. I hope I answered your question.
Yeah, I can only second that. Thank you very much, Mehailah. And unfortunately, we ran out of time, but I can only encourage you during the break, everyone wakes up. No, not yet. During the breaks to network, approach the panelists, ask more questions, learn from them, because I think what we have witnessed over here is vision and leadership and integration, customer centricity and people centricity in action. So I can only say thank you very much for the insights that you have provided us. I can encourage only you to please approach them as well during the breaks, get more information, hear other people that really drive this country and actually provide us with this wonderful environment that we're living in. Thank you very much for all of you guys, and enjoy the rest of the conference. Thank you.